Let's talk about meningitis. Basically, meningitis is an acute viral, or it could also be a bacterial infection that causes inflammation of the meningeal tissue, which is what covers the brain and the spinal cord. You have to take note that droplet precaution have to be maintained for the patient with meningitis until antibiotic therapy is given, okay? Now, what are the causes of meningitis? Well, like I mentioned before, bacteria, specifically Haemophilus influenzae and Neisseria meningitidis. So how do we diagnose a patient with meningitis? Basically, we do the lumbar puncture procedure, and this will show an increase in CSF pressure, obviously due to the inflammation, and an increase in WBC count, which is due to the infection. Now, when we're doing the lumbar puncture procedure, we have the patient side lying with head down to the chest with legs pulled up, so it's almost like a fetal position. The needle would be inserted in the lumbar area around L4 and L5, and prior to the procedure, we would tell the patient to empty the bladder and also tell the patient about the position, the side-lying position, which is also called the lateral recumbent position with knee flex. So how do we assess this patient? Usually a patient with meningitis would be confused, would have lethargy, would have a fever, would have nuchal rigidity, which is stiff neck, and we have to be careful to manage the patient's increased intracranial pressure. It is also very important to take note for the NCLEX about the two tests that is used to test for meningitis, specifically Brzezinski's sign and Kernig's sign. Now with Brzezinski's sign, there is flexion of the hip and knee when the neck is flexed. Now with the Kernig's sign, when you have the patient supine, lying down, the patient has a hard time straightening the leg when flexed at the knee and the hip. A more reliable diagnostic evaluation for this patient would include a lumbar puncture, and this would show an elevated CSF pressure. It would also show a cloudy and a milky white CSF. Now, if it's a bacterial meningitis, when we do a culture to identify the organism, it would show a positive Gram stain. So what can we do for these patients? It is important for the patient to get plenty of rest. We could also provide IV fluid administration if needed. We can give the patients antibiotics as ordered, such as penicillin G or ampicillin. We can also give the patient a corticosteroid such as dexamethasone to help induce the inflammation. We can also give the patient anticonvulsants such as phenytoin and phenobarbital, and we can also give the patients laxatives such as Dulcolax and stool softeners such as Colace in order to help the patient not strain and maintain a normal ICP or intracranial pressure.